Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Please remember these videos are designed to educate you but not replace visits to your physician. So if you have questions, give your doctor a call. We're happy to help you here in our office with same-day appointments, area code 775-359-7111. Today I want to talk about taking temperatures. This is a huge deal in my practice and something that we run into all the time. Let me first say, if your child is under 60 days of age, does not matter what is going on, if you think your child has a temperature or a fever, you have to use a rectal thermometer, and anything over 100.5 is an emergency. Call your physician immediately. Do not use pacifier thermometers, do not use forehead thermometers, do not use under the arm thermometers. Use a rectal thermometer in children under 60 days of age 100% of the time. That is every single time. Children with fever over 100.5 under 60 days of age have a 1 out of 10 chance of having significant bacterial infection, and those serious bacterial infections can be in the brain. Okay, if they're in the brain, they're fatal. So over 100.5 rectal temperature under 60 days of age, call your doctor right away. In the middle of the night, go to the emergency room. This is a real emergency. Over 60 days of age, as a physician, we don't care too much about the height of the fever. We do worry about fever that's not gone after 5 days. If you think your child has had fever for more than 5 days, take a temperature. It's got to be a real temperature. Please take it. Because if it's not gone after 5 days, we need to know about it. And the things on the list that we're worried about there include leukemia and cancer. So there's some very serious diagnoses here. We need to know how high that temperature is. If you are taking a temperature when your kid is, or your child is acutely ill in the first 4 or 5 days, and I do recommend that, over 60 days of age, realistically under the arm or the temporal artery thermometers are fine. When your child is older, under the tongue is probably the best, but lots of children just won't cooperate with that. That's okay. That's where the other thermometers come in. Please, under no circumstances, should you give a number when asked how high your child's fever is. If you did not use a thermometer, tell us he felt hot, but don't generate a number for us. That leads us to a false sense of precision, and as physicians, we start making medical decisions based off of the height of the fever. It was 105, we do a whole bunch of tests for you. It was 102, we skip a whole bunch of tests. If we don't know how high that was because he felt hot, we can judge accordingly. But if you give us a number and we believe you when you did not use a thermometer, that puts your child at significant risk of having unnecessary, dangerous, painful tests done, unnecessary, dangerous medications given, or conversely, necessary life-sustaining diagnostic tests withheld, necessary life-sustaining antibiotics withheld, because you generated a number when you didn't take a temperature and we believed you. So please, if you felt the child's head and they felt hot, tell us, he felt warm, but I did not use a thermometer. That is acceptable. But don't tell me he felt like 105, or worse yet, he was 105. Because if the doctor does not ask the next question, how did you take that temperature? And find out, well, we took it with the back of our hand. The physician very well, especially in the emergency room where they're very busy, might just start ordering tests, and you'll find some very unpleasant things happening to your child as a result of that false degree of precision. So you've got to use a thermometer. They can be bought for 98 cents at the pharmacy. I hope this has been educational, and I hope you understand this video is as much of an educational series as a plea from me as a physician. Please actually take a temperature. If you don't take a temperature, tell us you didn't take a temperature. Don't give me a number, because if you give a number, we assume that that number is real, and we assume precision, and we start to make decisions based off that, and it comes to patient harm. We don't want to see that happen to anybody. If we can be of assistance here in our office, give us a call at area code 775-359-7111. We'll see you next time.